Hi everyone, I am Dr. Maheshwari, fertility consultant from Oasis Fertility, Ananagar, Chennai. Here we see what is PGT-A, pre-implantation genetic testing for aneuploidies. Before going in detail, we first see whom all to be tested for PGT-A. So in women with recurrent implantation failure, we offer them PGT-A, as well as women with recurrent abortions can go ahead with doing PGT-A. And also in family history of genetic disease for either of the partner, we can go ahead with PGT-A. And the fourth thing is, the previous child born with any kind of genetic abnormalities, they can very well go ahead with PGT-A before planning for the next conception. Okay, what is PGT-A? Well, during the embryo formation, in the blastocyst, that is the day 5 formation of embryo, we can do the biopsy and we can subject the biopsy form to genetic analysis and we can freeze the embryos. So we will get the reports as whether it is normal or abnormal. The normal embryo is said to be the euploid form and the abnormal embryo is said to be the aneuploid form. So in case of aneuploid, we have to discard the embryos, and in case of normal euploid embryo, we can go ahead with the embryo transfer. And in case of PGT-A, we can go ahead with single embryo transfer. That is one main advantage. And also this increases the success rate compared to non-PGT-A screened embryos. These are all the improvements in case of PGT-A. And there is one another terminology said to be PGT-M. So this is for a single gene defect screening of the embryos. We said to be the pre-implantation genetic testing for monogenic diseases. This can also be offered to a couple who are all having the single gene defects in their family. And even for the first transfer, we can go ahead with doing PGT-A whenever the women age is like above 40 or the men age is more. If they want to go ahead with the genetically normal embryos, before the first embryo transfer itself, they can subject their embryos for the PGT-A, and if they get a euploid form of embryos, then they can go ahead with single embryo transfer and can get successful genetically normal born baby. Thank you so much.